Hi everyone, I am Dr. Muniraj, consultant dermatologist, venereologist and cosmetologist. I have completed my post-graduation MD DVL from the Institute of Dermatology, Venereology and Leprosy, Madras Medical College and Government Hospital. Regarding dermatology, usually you will get 6 to 7 questions from dermatology as image based one or statement based one. 2 to 3 questions linked with your basics directly or indirectly. So grossly if you take, usually you will get 8 to 10 questions from dermatology. So I will present you the dermatology in the order of anatomy, physiology, pathology, pharmacology, sexually transmitted diseases along with microbiology, and finally will end up in special dermatology. Why this order? What is its significance? By this way you can understand the basic concepts very well, so that when I come to special dermatology it is easy for you to apply, understanding will be better and recollection will be good. Second thing is, in this order I will cover certain general topics also linked with the dermatology. For example, when I come to pharmacology, some topical antibiotics, topical antifungals, antivirals and certain immunosuppressants will be discussed in detail. When I discuss sexually transmitted diseases along with the microbiology, your Neisseria gonorrhoeae, syphilis, Treponema pallidum, Haemophilus ducrei and the Calymatobacterium granulomatous, herpes virus and human papilloma virus will be discussed in detail. So by this way you understand the concepts very well. Why? So whatever the entrance examination may be, whether it is NEET PG or INISET or upcoming next exam, understanding the basic concept is essential for you to apply in that particular subject. So that's why I'm giving so much importance to basic concepts for nearly 5 to 6 hours and 7 to 8 hours for special dermatology, right? By this way you won't forget, right? Whenever you know the reason behind the clinical scenario, whenever you know the reason behind the pathology, you will enjoy in reading. Yes. Now let's start with anatomy. First we'll discuss about embryology, right? When we'll start with embryology, first we'll see development of epidermis. So development of epidermis starts from 3rd week of gestation. So whenever you ask you the question, development of epidermis starts from, your answer is 3rd week. Then what happens in 6th week? That's get doubled. 3 gets doubled as 6th. So you will get 2 layers. So epidermis will be seen as 2 layers in. So epidermis will be seen as 2 layers in 6th week of gestation. Remember like that, 3 gets doubled. So 2 layers. 6th week 2 layers. Then your question is keratinization. So keratinization of surface appendages occurs earlier than keratinization of surface epidermis. So keratinization of appendages occurs initially before your surface epidermis. So when it occurs between 11th to 15th week of gestation, right? It occurs in 11th to 15th week of gestation. If they ask you the question, when keratinization of sebaceous gland occurs, your answer is 11th to 15th week. So for that you should know what are all the appendages. Appendages are sebaceous gland, apocrine glands and eccrine glands. So keratinization of eccrine glands 11th to 15th week of gestation. Keratinization of apocrine glands 11th to 15th week of gestation, right? Then keratinization of epidermis, that occurs in the gestation of 22nd to 24th week of gestation. So if you ask you the question, when the development of epidermis starts at, your answer is 3rd week or 22nd week. Yes, 3rd week. If they ask you keratinization, then your answer is 22nd to 24th week of gestation, right? Yes, this is a picture of a single layer of epidermis at 3rd week, right? This is multi-layered cornified cells. See, the basal and suprabasal cells are nucleated, and supermost layer, that is cornified cells, are seen in stratum corneum. And your question is, anucleated cells are seen in. So anucleated cells are seen in stratum corneum, right? That indicates dead cells. So dead cells are seen in stratum corneum. Anucleated cells are seen in stratum corneum. Dead cells are seen in stratum corneum, right? Then appendageous organs. Sebaceous gland, apocrine gland and eccrine glands are appendages, skin appendages, right? All the three glands start developing from your hair pegs. So development of appendages comes from hair pegs. Among the three appendages, sebaceous glands alone start functional by 13th to 15th week of gestation. Yes, sebaceous gland alone start functional by 13th to 15th week of gestation. This is another MCQ, right? Which appendages start functional in gestational period itself, and your answer is 13th to 15th week of gestation, right? Their size once again decreases at birth and it enlarges and function start once again at puberty, right? Then apocrine glands and eccrine glands. What is these two glands? These two glands is involved in sweat, right? Eccrine sweat is responsible for thermoregulation. Yes, thermoregulation. Your apocrine gland is responsible for body odor, right? And pheromonal action, that is sexual attraction. So apocrine gland start functional only at puberty, right? Apocrine gland start functional only at puberty and they are more concentrated in your axilla and pubic region. Eccrine glands, yes, eccrine glands start developing from hair pegs, right? Hair pegs, and they are more involved in thermoregulation. It start developing from 3rd month, right? On palms and soles, and 5th month all over the body. In 8th month, the secretory cells of eccrine glands seen. By 9th month, your myoepithelial cells are evident. What is the significance of myoepithelial cells? Myoepithelial cells is responsible for contraction of ducts, and they will pour the sweat to the surface epidermis. So myoepithelial cells is responsible for propelling the sweat towards the surface epidermis. That is start developing at 9th month of gestation. Eccrine glands start functional only at age of 2 years. This once again MCQ. So sebaceous glands start functional at gestational period of 13th to 15th week. Apocrine glands start functional just before puberty or at onset of puberty. Eccrine glands start functional at 2 years of life, right? So regarding eccrine glands start developing from 3rd month on palms and soles, 5th month on all parts of the body. Then important question is 8th month, that is myoepithelial cells, and significance of myoepithelial cells is propelling the sweat towards the surface epidermis, right? So it start functional by 2 years. So appendages or sebaceous